Imagine waking up with a chest that feels as heavy as a weight, a cough that just won't quit, and every breath sounding like a scratchy record. It's frustrating, uncomfortable, and can sometimes be a little scary. You're not alone if you've been there. Chest congestion is incredibly common, and the causes behind it are as varied as the symptoms. Let's break down what chest congestion is, why it happens, and, most importantly, how you can tackle it. From the flu to chronic conditions like asthma and COPD, understanding chest congestion helps you make the best choices for your health. We'll go over the symptoms to watch out for, and when it's time to get a doctor involved. By the end, you'll have a clear idea of the steps to find relief and how to keep your lungs healthy in the future. What is chest congestion? Chest congestion is what happens when mucus, or phlegm, builds up in the bronchi and lungs. This mucus isn't just annoying, it can make you cough, sound wheezy, and feel like you're breathing through a clogged straw. Sometimes, that cough becomes productive, meaning you're able to bring up some of that thick, sticky mucus when you cough. It's a symptom that can come and go with an acute illness, or linger on as a result of a chronic condition. Acute illnesses like the flu or a chest cold are common culprits, while longer-term conditions, such as asthma or COPD, can cause continuous chest congestion. And if you hear a crackling sound when you breathe, that's often a sign that congestion is affecting the airways deep in your lungs. What causes chest congestion? 1. Acute illnesses. Temporary illnesses can lead to short-term chest congestion. This usually comes with other symptoms like fever, chills, and a general sense of discomfort. Here are a few specific causes. The common cold and flu. These viral infections can cause congestion, stuffy nose, fever, and fatigue. Flu can hit hard, causing not only chest congestion but also serious complications if not addressed. Acute bronchitis, often starting as a dry cough. Bronchitis usually leads to a productive cough where mucus changes from clear to yellowish-green shade. COVID-19. Though COVID-19 affects people differently, chest congestion, cough, fever, and body aches can be symptoms. If you're struggling to breathe or experiencing worsening symptoms, it's important to get medical care quickly. 2. Chronic conditions. Chronic illnesses, like asthma and COPD, can cause ongoing or recurring chest congestion. With these conditions, mucus production is a constant problem, meaning you'll experience regular episodes of congestion that don't fully clear up. How can you relieve chest congestion? 1. Home remedies for relief. Steam inhalation. Steam from a hot shower or bowl of water can help loosen mucus, making it easier to cough up. Stay hydrated. Water helps thin mucus, making it less sticky and easier to expel. Honey. This natural remedy can help soothe a sore throat and thin out phlegm. Humidifier. Adding moisture to the air with a humidifier can keep your airways from drying out, reducing irritation. Rest. Allowing your body time to fight off an infection is crucial. Make sure you're sleeping enough, as rest is your body's natural way of recovering. 2. Lifestyle changes. Quit smoking. Smoking irritates your airways and causes mucus to build up. Quitting smoking will make a massive difference in managing chest congestion. Avoid dairy. For some, dairy can make mucus thicker. Try reducing dairy intake when you're congested to see if it helps. Stay active. Moderate exercise can help clear your lungs and improve your overall respiratory health. When should you see a doctor? Sometimes chest congestion is more than just a nuisance. If you have symptoms that persist, it's wise to get a professional's perspective. Here are some red flags that warrant a visit to your doctor. High fever. If your fever rises above 100.4 degrees Fahrenheit, especially if it persists, it could be a sign of a more serious infection. Coughing up blood. This isn't normal and could indicate a serious condition. Shortness of breath or chest pain. Difficulty breathing or intense chest pain can be signs of a heart attack or other serious issues, and you should seek emergency care. What to expect during a doctor's visit. When you see a healthcare provider for chest congestion, they'll start by asking about your symptoms and medical history. After that, they may listen to your lungs to hear any unusual sounds. If they suspect a serious underlying issue, they might order an X-ray or blood test to get a closer look. These tests can help identify infections, inflammation, or other concerns that might not be visible from symptoms alone. Frequently asked questions. 1. How long does chest congestion last? This really depends on the cause. With acute bronchitis, for example, congestion can last up to 3 weeks. But if you're dealing with a chronic illness, you may experience frequent or ongoing congestion. 2. Is chest congestion a symptom of COVID-19? Yes, it can be. COVID-19 has a range of symptoms, and congestion is one of them. Watch for breathing difficulties or recurring symptoms after a few days of feeling better. This can be a sign to seek emergency care. 3. When should I be concerned about chest congestion? Call for emergency help if you're coughing up blood, having extreme chest pain, or struggling to breathe. Otherwise, if your symptoms last longer than 3 weeks, consult your doctor. Final thoughts? Chest congestion isn't just an annoyance, it's a signal from your body. Whether it's a symptom of a short-term infection or an ongoing health issue, it's something you can manage with the right tools and knowledge. By taking proactive steps, like staying hydrated, using home remedies, and knowing when to seek medical attention, you can keep your lungs healthier and feel more comfortable breathing every day. Listen to your body, take steps to manage your symptoms, and don't hesitate to get professional help if needed. Every breath counts, so let's keep them as clear and easy as possible.